Hey there, thanks for clicking on today's video. If this session helps you relax, we'd love to have you on Patreon, where we share exclusive massage therapy content. Your support truly keeps these sessions going. When someone comes in with a lot of pain, you don't want to just cause them a lot more pain initially. So I do like to, especially with when someone has a sharp, intense pain in their shoulder, I like to start with something more soothing, but really give them what they need to, which is going to be uncomfortable, but to kind of lead up to it. Doing some compressive work in the upper traps can be pretty soothing. And I like using the heel of my hands because it's kind of a fattier part of the hand. It's not going to feel too intense. And as I'm doing the warm-up, I also don't want to do things that aren't going to be making the most of my time. So I don't want to do low back work if Amanda's having pain in her shoulder. So definitely staying focused. Doing some compressive work on top of the shoulder blades. This is a really awkward angle to try and work on the rotator cuff muscles from, but just warming up everything. And feeling pressure on the arms in a way that feels good can also be nice if someone has pain in their shoulder. You want to get clear on what kind of pain it is. If it's a sharp pain, if it's a dull, constant pain. If it's a pain that only happens when doing certain things. And a warm-up can be as simple as that. And I'm gonna grab my oil. When somebody is in either an acute amount of pain or a lot of pain, my goal is just for them to feel better. So it's important to stay focused on how you can help and use techniques that will help. That might sound obvious, but you don't want to be doing 20 minutes of effleurage on the back if somebody has a very specific kind of pain in their shoulder. So I might not go down the whole arm, but I do like to do a little effleurage for the arms, and including the deltoid, the triceps. Just feels really nice. Running my thumbs over the deltoids and squeezing on my way down. So treating this whole area as one. It's really good to work the upper traps from different angles. and just gradually sinking in a little deeper. You can also slow it way down. If somebody is like complaining of pain in their shoulder, like in their deltoid area, I would think that might be referral pain for maybe the infraspinatus, or the bicep tendon might be a little swollen or something going on in there. So I don't want to just jump to spending a half hour working on that area where the pain is. A lot of the time it's referral pain. And always with that upper trap, I like to just focus on the neck as well. So depending on time, that may be enough for the upper trap if you want to focus on other things. So I'm going to go ahead and focus on this the deltoid a little more. And it helps if you expose that deltoid muscle a little more. I'm just going to do some work in here with my thumb, using as much of my thumb as I can. And when you're doing a more therapeutic massage, don't worry about having like a perfect flow. Just focus on helping your client feel better, addressing the areas that you need to. Do some pin and stretch in here. This is the same technique that I'll use for the bicep tendon. And I want to make sure that I structure this massage. I'm using my thumb pretty intensely. So I want to make sure I'm giving my thumb enough breaks where it doesn't feel super sore at the end of the massage. And moving into the bicep tendon. So first I'm going to do just a gentle pass down, making sure that there's no swelling. And I'll often just shake out my hand as well if I feel my thumb starting to get sore. Just creating a little more space in that bicep tendon is enough to sometimes alleviate the pain a lot if it's in that deltoid area or in the shoulder joint. Sometimes you can pull on the bicep tendon in a way that puts a lot of pressure on the deltoid. And I'm just going to work this muscle fiber deltoid from a different angle. And I'm just gonna give my thumb a break as well. Doing a little bit of petrissage in there, but the arm is just a little floppy, so it can feel a little fumbly sometimes. And we're in a really good position for the rotator cuff muscles, and this is a great sequence as well after doing that work. I'm gonna go ahead and land on that infraspinatus. And I'm just gonna use the heel of my hand for a little bit, give my thumb a break. And it's really important that you nurture a balance when you're giving a deep tissue massage like this that's more technical, that you're taking care of yourself in the process. So even if the thumb would be the better option for your client here, if it really hurts, then I would use a different technique. That's why it's also helpful to keep learning new techniques and have knowledge of a lot so that you have options. At this point, my thumb's feeling better. I'm going to use reinforced thumb to give myself a little more support. Really normal for this to feel difficult because the infraspinatus is so thick. Doing deep tissue on it can feel more challenging than other muscles. Moving on to the Teres minor and major. My goal with all of this is to take pressure off of the shoulder to create more space in these areas that help move the shoulder. And I do like to do a little more work for the upper trap after doing that kind of work in the rotator cuff muscles. And I like to just create a little more space in the upper back by the stretch of the arm, making sure that Amanda's elbow is protected, staying bent as I pull. I don't have much glide here, but this is exactly what I want for the trigger point work that we're going to do. Also, in between this trigger point work, I like to do just some effleurage strokes with my arm. And I like to really emphasize the movement in my body because it's easy to feel a little bit like contracted myself when I'm, doing the trigger point work. It's deep tissue. And the last area that I do want to make sure to work on with a lot of different kinds of shoulder pain is the levator scapula. And with this deeper upper back muscle, neck muscle, I like to just ease my way in. It's really important for the health of the muscle tissue that you use at least some finesse, that you're not just trying to jam your, elbow in. It really helps if you can stretch that muscle tissue as you work and just gradually reach the deeper layers of tissue that are more contracted, that need to stretch and open. There's a good kind of soreness after a deep tissue massage, and there's a not so healthy kind of soreness. It can feel really nice to even do a few effleurage strokes along the lats after that rotator cuff work. And I don't have much oil, but I'm not too concerned about it. And just ending with some effleurage strokes into the neck.
Thank you for watching today's massage therapy session. We truly appreciate your support. If you'd like more exclusive content, join us on Patreon and be sure to subscribe so you never miss a session. Take care, and we'll see you next time.